Welcome, everybody. I am delighted to be with you all for this webinar. You will listen to testimonials of entrepreneurs on the resilience of decentralized water enterprises during the crisis. I am Valérie Mazon, working at DENN Communities, where I am in charge of the portfolio of water access social enterprises, and I will be the moderator of this session. Today, we have three entrepreneurs with us who will share their experiences. Divya, CEO of Nandi Water Services, operating in India. They are selling to more than 850,000 people 20-liter jugs every day. Julien Ancel, CEO of 1001 Fontaine, operating in Southeast Asia, impacting every day more than 500,000 people in Cambodia and Madagascar. And Joseph Sam Cherbou of Safe Water Network, operating in Ghana, with a slightly different model of household home connection, but he will explain us later on what it is. There will be Q&A session after each speaker, so you can write down your question on the Paceable platform, and Céline will manage the Q&A. Slide, please. So I was mentioning that I am working for DENN Communities. So what is DENN Communities? DENN Communities, it is an impact investment fund committed to support social enterprises which address social issues through innovative business model. We bring capital and technical managerial expertise, and we focus where we can bring values, access to nutritious food and access to safe drinking water. The portfolio of 15 social enterprises that we have are reaching every day more than 10 million people. We have been pioneers in supporting decentralized safe water enterprises because we believe in this model as being sustainable, scalable, adaptable. Today, we'll focus on decentralized safe water enterprise and water kiosk. Next slide. So what do we call decentralized safe water enterprise? No, before. Thanks. So under safe water enterprise, we have three types of business model. One is water kiosk, one is about technology, and the last one is about home filter. Today, we will focus on water kiosk. And in order to ensure we all understand what is a water kiosk, I suggest you to go on the Paceable platform to fill a quiz. We have 2 minutes to answer the few questions you have on the Paceable platform. Up to you, go on the Paceable and fill the quiz. Next slide. You have a few seconds left in order to fill the quiz, and then we'll come back to look at the answer. Okay, so let's look at the answer of the quiz. Next slide. So the first question was about what is a water kiosk? And indeed, a water kiosk is a small unit, all in one, extracting, treating, selling, and distributing the water. It is modular, flexible, and most of it, it's anchored into communities. So it serves the communities around the water kiosk. Usually it sells jug of 20 liters to consumers around. It is a smart solution which has proven to build resilient societies and ecosystem. Next slide. So in terms of the cost effectiveness of water kiosk, indeed, it's low capex intensive. Usually a water kiosk is between $10,000 to $30,000 for a water kiosk, and it can reach between 300 to 1,000 people, depending on where you are operating. And usually selling between 150 and 200 jugs by day make the water kiosk profitable. So very cost-effective solution. Next slide. In terms of, next slide. In terms of impact, today we estimate that it reached more than 10 million people. So it's good, but there is still lots of room for improvement because, as you know, today 2 billion people lack access to safe drinking water. So there is a potential to scale this model in order to reach even more people. Next slide. In terms of impact on SDG, it might not be so obvious, but in fact, beside SDG 6, there are lots of other SDG that water kiosk impact. And I just want to name but a few. The first one is about quality education and gender equality. It is true that having a water kiosk enables girls to go to school because they will not go and fetch the water. Usually they go for 6 kilometers to find water. Having a water kiosk in their community, they don't spend this time, therefore they can go to school. On climate action, having a water kiosk prevents for boiling water. So therefore, cutting greenhouse gas emission and deforestation. So lots of SDG are water issue. Next slide. So I think that you have understood what is a water kiosk. It's all-in-one, it's modular, it's cost-effective, it's climate positive. It is time now to listen to our entrepreneurs who will explain how resilient they have been throughout the crisis. And we will start with Divya from Nandi. Divya, maybe you can start by explaining what is Nandi and explain how you managed throughout the crisis. Sure. Divya, the floor is yours.
Yes, thank you, Valerie. Hello, everyone. Good afternoon. I'm very happy to be here. So like Valerie said, I lead Nandi Community Water Services. So Nandi is a social enterprise that was set up in 2010 with the mission to save lives by providing access to safe drinking water to underserved communities in a sustainable manner. So we operate the water kiosk model. What we do is we go to places with highly contaminated water, either industrial pollution or geogenic pollution. And we set up water centers, water kiosks with capital that we raise from donors. We purify the water in partnership with the local governments, and we provide it back to communities at a nominal charge. This nominal charge is usually less than $2 a month. So they get water for the entire month for less than $2 a month. So what I'm going to be sharing now is I'm going to be sharing with you all how COVID-19 has impacted us and what we did to be able to continue our impact. Probably a lot of you know that India had gone into a lockdown last year on the 24th of March. Actually, it was one of the strictest lockdowns in the world with very little time for us to prepare. You know, we had started with a lockdown for 1 day, and that actually had extended to about 100 days, and we didn't have time to prepare at all. So like a lot of other organizations, we were also quite impacted. When we had done an initial assessment, we realized that if we didn't take steps, we could have been impacted up to 40%. Our revenue could have been impacted by about 40%. Why is this? Essentially, because of these 5 reasons. First being that we are an extremely high touch business. What does this mean? Our team, our sales team, our community team goes into villages every month to conduct activities and bring about behavior change so that people start drinking safe drinking water. Because a lot of times, if the impurities are not seen, they don't realize that the water is impure. So this requires a lot of action by the sales team in the villages. And this would have impacted us. Now that there was a lockdown, the sales team couldn't travel, would have impacted us by about 17% of our revenue. The next one is, like I said, the capex comes from donors. However, in some organizations, we also have a service contract with donors where they provide us with the opex as well, especially if their factories are around, etc. And what happened in this last year is that every business got impacted. And if the business got impacted, they didn't have the money to give to us. And this would have impacted us between 6 to 10%. Third is we have about 6 to 10% of our revenue coming from schools. So we provide safe drinking water to school children across various water centers, various villages. And given that schools were all closed, right? So we couldn't anticipate for how long they'd be closed, but actually it turned out that the schools were closed for the entire year. And so this would also impact both our social impact as well as our revenue. Then we were, one of the things that we do is that we provide water to not just the village that we are stationed in, but villages outside as well. So given the lockdown, we couldn't set foot outside the village in which the water center has been established. So that was again limiting our social impact as well as our revenue by about 6%. Last but not the least, we have an urban portfolio, which is a small portion of our portfolio, but actually the largest or the fastest growing one. In the urban portfolio, about 70% of the sales was coming from B2B businesses. Now, with the lockdown, overnight, businesses all shut down. Like I was saying, we didn't have time to prepare. It was announced today and the lockdown was from day after tomorrow. And we didn't have time to prepare, and suddenly all businesses were shut down. So we had lost about 70% of the urban portfolio. This was approximately around 8% of our revenue. So everything put together, we thought that we had assessed that we could lose up to 40% of our business and social impact. And obviously we couldn't afford this, so we needed to do something. Next slide, Celine. So the first thing we did on the day that the lockdown was announced is that we decided we had to organize ourselves to be able to, combat this lockdown. And so the first thing we did is we set up 3 committees. One committee for rural business continuity, the second for urban business continuity, and the third one for employee welfare. So the rural and urban business continuity committees were in charge of ensuring the water was safe, the facilities were safe, and we would continue to serve people and keep our operations running. And the employee welfare committee was set up to ensure that all our employees were safe, because they were going into the field to ensure that people were having access to safe drinking water. So we did various initiatives we took up various initiatives for ensuring the safety of our consumers and of our employees, and to ensure that they had information about COVID and they were safe and their morale was high. With this was implemented by 1st April, all of these initiatives. You can see some pictures of the same on the right-hand side. And all these initiatives had helped us build our trust and loyalty in the communities and employees. Now, like I said, we were going to be impacted by about 40% because of the various things that I shared in the previous slide. So we obviously needed to also take up initiatives so that there was business continuity and impact continuity. And for that, we did a couple of pivots. Next slide. The first one, like I said, we were very, very high touch, and suddenly we needed to move to be a low touch organization. If you can see the picture over here, this is how all our consumer data was maintained. Every village had one register in which we were maintaining consumer data. So obviously with this, we weren't able to get in touch with our communities. So we needed to get digital. I've been trying this for a while, but like with a lot of organization, there was a joke going on. What led to digital transformation of your company? Is it your CEO? Is it your CTO? Or is it COVID-19? For us, for sure, it was COVID-19. So suddenly what we did is the entire community data or consumers data, we had them digitized initially into Excel sheets to begin with. Then we did an entire consumer study to be able to understand what were the social media preferences of people, what of our communities, of our consumers. So in the survey, for example, we understood that the South was a whole lot more savvy with social media than the North. And on the basis of that, what we started our implementation process by creating WhatsApp groups for key opinion leaders, for retention of users, for recruitment of users, etc. for the South, and through telephone calls in the North because they weren't very social media savvy. One of the good things was that we've seen that there was very high interaction. Market trend is that 10% of the people you reach out to read your messages, but we actually had 76%. And so we were able to maintain the same kind of information flow despite not being able to travel. So we went from high touch to low touch. Next slide. Next slide. Okay, thanks. The next one is, like I said, schools were closed, so we weren't able to provide water to school children. When we were trying to understand through our calls, WhatsApp groups, etc., as to how the children were faring, we realized that they were quite badly hit, not just academically, but also in terms of nutrition, health indices were going bad, etc. So we waited for things to stabilize a bit, but when we realized that the schools were not going to open, we pivoted. What we did was we went to the schools, took the list of all the school children, and instead of serving in the school itself, what we did is reached out to the parents, gave them coupons, and asked them to collect the water from us so that the children continued to get water. And with this, we were able to serve a majority of the school children for the later half of the year. Instead of 30,000 that we were serving the previous year, we were able to serve up to 25,000, a majority for the second half of the year. Third slide. Okay, thank you. Like I said, for the urban portfolio, we had lost 70% of our sales because B2B, we had lost all our B2B customers. So we had to take up best-in-class safety procedures, practices, become contactless, etc. And we shifted our consumer segment to B2C before any of our competition, right? Even the very big players weren't able to quickly adapt. but we were able to shift much before our competition went above quality norms placed by the government, redesigned our sales approach, and redesigned our supply chain and operations. And with this, we went from a loss of 70% to, by the end of the year, we were able to increase our sales and impact by about 42%. So this was the third shift. So we formed communities, we went from high touch to low touch, we shifted we pivoted for school water so that we could continue to serve our children. And last but not the least, we engaged with B2C consumers so that we could continue to serve them. Next slide. Next slide. Yes. So with this, we were able to maintain our social impact, in fact, increase it slightly because we were providing water to quarantine centers, etc. But for sure, maintain it instead of the loss of 40%. A huge increase in trust and loyalty, because through our social media, we were able to share with them about the, bust all the myths around COVID-19, tell them to stay safe, stay healthy, etc. And we arrested the revenue drop from 40% to 7% with an improved profitability. This 7% actually came because some of the donors were not able to give us the money last year because they were not faring well. Service contracts were not renewed. But again, this year they're back, and this year we're much higher than before. So this is how we were able to manage through the crisis. Thank you, everyone. And I'm happy to answer any questions that you may have.
So just to remind everybody, so you can put your question on the Q&A on the Paceable platform. So don't hesitate, and you will have for each speaker a specific time to ask question. So Divya, I have a question for you before we go through the question on the Paceable platform. Is you were saying that the borders between provinces were closed. So how did you manage to travel? Because you're operating in lots of different provinces.
We actually didn't, okay, two things, Valerie. One is for initial phase, we didn't travel, we took passes and permissions from the government because we are essential services, but kept the travel to minimum. So about 20-25% of our overall travel. But the remaining portion, we were able to do everything that we needed to do through our digital communication, because travel was essentially needed for communication, for awareness, and for cash collection, all three of which we had moved digitally, even cash collection. So that was one big thing that we were able to do.
Thank you, Divya. We have the first question from the crowd. Can you tell us if there were any government response or engagement during the COVID spread to Nandi water? How did the government reacted after all you have done?
Couple of things. Do you mean how did they support us during the pandemic, or how did they reward us later?
Any government response or
Okay.
engagement?
So initially during the pandemic, one of the things, for example, the state government of Haryana had provided us with masks and sanitizers, etc., so that we could distribute them amongst the consumers, and also gave us the material to educate people. We also got a lot of testimonials from government and the PHED, which is Public Health Education Department. A lot of testimonials for our water center assistants, appreciating the work that they had done. So this is how government really supported us. And of course, after the pandemic, we have also received some awards for the work that we did during the pandemic.
Thank you, Divya. And can we have a short answer to this question? What is the most important business lesson for the post-COVID period?
Agility. You've got to be agile to constantly adapt to the changing environment.
Thanks a lot, Divya. It is amazing to see while the pandemic was really eating the fundamentals of your business model. You were explaining very well. So high touch model, the donor, your customer, you have managed to ensure business continuity. So congrats, because thanks to you, you are continuing to secure access to safe drinking water by adapting, pivoting your business model, and while being financially sustainable, which is also key in order to survive after the crisis. So it is a great example of resilience. Thank you. Now we will stay in the same geographic zone with Julien Ancel, CEO of 1001 Fontaine, who will illustrate how the pandemic has enabled to reinforce their mission to maintain access to essential services, as well as open new opportunities, partnership. Handing over to you, Julien.
Thank you very much, Valérie. Hi, everyone. So I'm Julien. I'm the CEO of 1001 Fontaine. We are a social business providing safe drinking water to vulnerable communities in 4 countries. We have a model that is very similar to Nandi. So we produce water in 20-liter jugs. We deliver at home for a price of 2 cents per liter, which remains affordable. And we manage our operations as a franchise. We impact today about 900,000 people. So obviously in countries like Cambodia, Madagascar, Myanmar, Vietnam, the rise in COVID cases and lockdown decisions had dramatic consequences. So we had to act very fast, like Divya. So by the end of March 2020, we had a crisis plan operational for each country. We had a crisis team at HQ level, and we had frequent interaction with the non-communities and other organizations of their portfolio to capture best practices. So we took some very complementary actions to what Divya said, but I'll just focus on a few other one and share the analysis of why we believe the resilience of our model has an increase. So in Cambodia, we are the largest water producer countrywide. So pressure was obviously high to maintain access to water as an essential services. And very soon after the upsurge of the pandemic, we could observe that water took even more importance than before for the communities because they were just more than normally worried about their health. And the economic impact of COVID created a regression of consumption power and taught people to focus on essentials, hence the importance of developing very affordable solutions like water. And if you had the fact that many people lost their jobs in factories and had to come back to their villages, we observed actually a rise in demand. So there was a big pressure indeed on the supply side, and the main challenge was business continuity. So next slide, please. So the first thing was safety first. So as a water producer, we already had strong measures in place, but we strengthened all of them. So we had to adapt all our methodologies. We could not organize any community meeting. We had to focus on door-to-doors. We had to secure consumables for a long period of time. We had to change our sales pitch. We had to secure the stock, and we emphasized more on health and safety. We delivered masks, soaps to our operators, and to prevent any shortages, we also used our own water quality laboratories to produce hand sanitizer. So as a result of those efforts, no single station was shut down because of COVID, and we haven't managed to open more than 30 new water kiosks last year. And the analysis is that the proximity created by community-based solution enhances mutual trust between a consumer and its water supplier. So our consumer base was very scared to even step down of their house. So we bring water directly to them with friendly places. So that really develops our mission. And although we were satisfied by the achievements of such business continuity, we progressively became much more aware of the impact of the crisis for the most vulnerable people. So we saw poverty surging and decided actually this year to launch a specific program together with the government. So the principle is that for each water kiosk, we select 50 of the poorest households that today cannot even afford to pay our water and support them with free water. So we are in the process of evaluating this program and to see how we can sustain access to drinking water for this specific segment, which is really the poorest of the BOP. So yes, operational continuity was ensured. We were happy that the clients maintained their trust to us, but the crisis also forced us, like most businesses, to not just focus on ourselves, but consider the ecosystem as a whole. So let's see that next slide, please. Because indeed, it did not take long after the crisis started to see us deal with multiple requests from support from local, national authorities, other NGOs. So we decided to play our part and to sort of strategically leverage these actions to reinforce our positioning as a key player in water quality in the country. So in Madagascar, for example, our local engineers designed 2 COVID compliant systems, one for water supply and one for hand washing with safe water and soap. And we actually equipped COVID response centers with those systems and providing them with free refill. Another example is that we provided free water to quarantine centers in rural areas. So some of these actions are still ongoing. We need to maintain them and leverage this recognition to develop even stronger partnerships and license to operate for water kiosk. That being said, again, the crisis of the COVID was not just about water, but it was about controlling the spread of the pandemics, which is all the more critical in remote areas where there is very limited infrastructure to treat patients. So we were also solicited by partners and government to act on that part. And we'll see that next slide. Because one of the particularities of the model of 1001 Fontaine is that we cover the last mile. So we are in rural areas, we deliver water at home, and we can reach very remote people. And actually, no, we haven't seen any organization in Cambodia that has such a footprint and the ability to deploy its model and its footprint at a fast pace, because as said before, we had to move fast. So together with the UNICEF, which has been a partner of ours for many years in Cambodia, we imagined a massive awareness campaign in more than 205,000 villages. So UNICEF provided us with posters and flyers on precautionary measures that population should follow, and our teams ensured that all those elements were supplied all across our network. So locally, we organized trainings with social distancing and distributed flyers to households. We also leveraged our own customer database to send SMS campaigns with key health messages and preventive measures to about 60,000 people. We also use social media, mostly Facebook, and supported even local entrepreneurs to rely health messaging through their own Facebook page. So that's another very interesting insight for us, and we definitely see these targeted initiatives as a means to promote health, not just beyond water, and also as a means to create unique relationship with our customer, prospects, but also institutional partners. So moving ahead to next slide, just to summarize what are the key outcomes for us, and the other slide before, please, and how we see the adaptation of our model to make it more resilient and impactful. So first, as I said, we will definitely place a stronger focus on awareness campaigns. We should definitely insist further on wash beyond water and highlight good hygiene practices in community meetings in a sustainable way. So we will reinforce these awareness actions, both for our customers, but also at school to ensure early adoption of those practices. The second thing we're looking into is to basically enrich our approach towards essential services, so without cannibalizing water, of course. So we supplied soaps during the crisis. It worked well. Why not launch a new categories? We're also investigating new options like the supply of porridge enriched with nutrients, which is very important for children. The third lesson is that we understand the growing importance of advocacy to our operations. So we need to work more with the governments to ensure the proper integration of our work in the national policy, because we've definitely managed to differentiate ourselves during this crisis. And last, and I guess like our organization, it was presented by Nandi, we need to develop more digital and unlock its value. So just to conclude, we have to remain humble because and alert, because the crisis is far from being open. But at this stage, there are some solid signs that our water kiosk model is resilient to huge external shocks, and that having a decentralized network with national level coordination is a significant strength. So the pillars of our model, we believe, constitute a solid basis against COVID. The quality, which is very much sought after during crisis, the affordability, and the availability to your doorstep. So it's a very exciting learning process. We are trying to leverage the situation to solidify our business model and therefore have more impact and a more deepened impact on the health of vulnerable population. Thank you very much.
Thanks a lot, Julien. So once again, you can put your question on the Q&A Passable platform. I have a question for you, Julien. I assume that it has a cost to promote WHO messages throughout all the villages. How did you fund that?
So it's a good question. So at very first, we use our own funds, but very quickly we got engaged with partners. So the UNICEF sponsored all the COVID messages campaign. So that was sponsored by the UNICEF. We've also been working with the UNDP on the proper program, and we've also solicited our existing donors. We have a program called the Water in School program, where we provide safe water for free. So obviously schools were closed, so we had this budget available, and we decided together with our partners to allocate that into specific COVID response for targeted communities. So at the end of the day, this didn't have any impact on our P&L.
Great. I have another question regarding your entrepreneurs, because you have obviously a lot of water kiosks and run by entrepreneurs. How did you manage to train, in fact, those entrepreneurs on the new procedures that needed to be put into place?
We were lucky enough to be considered by the government as an essential service, and therefore the limitations were not as strict as most organizations. So we had except in some specific moments where you would have decisions taken that would have to be applied overnight and you didn't know what to do. So we had those stress to manage, but overall, we've been able to go to the field. So we didn't have to change everything from face-to-face training to digital training. That being said, of course, we had to take some precautionary measures in the villages, but we managed to do so. We were somewhat lucky as well that the COVID pandemic didn't, I would say, start in last year. What started last year was the impact of the lockdown measures, but the real pandemic actually started this year. I think it's the same for India. So we had the time to organize ourselves in a way.
Julien, we have a question. I think it would be a good opportunity to talk about your model. The question is, did you find challenges going from providing free water to asking customers to pay again?
That's a very good question. So what we've seen is, in our existing customer base, we haven't seen customers deciding to stop buying water. Actually, the clients, the Pro program that we are doing now is mostly, and 90% of the cases are people who didn't buy our water before. So what we are trying now is to explore this new segment. So obviously now in this context, it's free. We want to see to which extent the fact that they have been accustomed to having safe water is going to turn them into long-term customers. So it's still under evaluation, but it's obviously a new category for us, and we'll have to see how to adapt our positioning, our mix for this particular segment. We obviously don't want to leave anyone behind, but if you're a social business, you always have to consider the balance. And we know that in the BOP, we cannot access the poorest of the poorest. And that's a question that we are confronted with, and we need to find answers.
Thanks a lot, Julien. Again, very interesting to see that the crisis as really highlighting, in fact, the strength of your model and the last mile to a point that NGOs such as UNICEF or the government have leveraged, in fact, it to meet their objectives. So it shows really that you are adding value to the community throughout your model. So congrats again to you and the team on the field. And I know it's not easy also for the moment in Vietnam and Cambodia where you are operating. Moving now to the last speaker in moving to Africa, in Ghana, with Safe Water Network, where we will see another example of reactivity and adaptation and doing the link with, in fact, free water. Because in Ghana, overnight, the government decided that this essential good water has to be given for free during the pandemic. So Joseph Sam, can you explain us more about the situation and how you have pivoted during the crisis? So Joseph did have some issue in terms of connection.
Thank you.
Ah, you're here. Good.
Yeah. Thank you so much. And then thank you for the opportunity. My name is Joseph Sam, and the head of sales of Safe Water Network. So in line with SDG goal number 6, Safe Water Network over the past decade and a half continued to get safe water to off-grid communities both in Ghana and India. But in Ghana alone, we have provided and continue to provide safe water to over 450,000 people plus, using 98 water stations across 10 of the 16 regions of Ghana in the past 11 years. And we were able to do all this with a simple model. Our mode of operation has been simple but unique. Community focused, involving Ghana government and its agencies in every step of the way. We source our water from the local community. We treat it to World Health Organization standards and then Ghana Standard Authority benchmarks. We train and also educate our local operators from the community to manage these stations. All the 98 stations is locally made, local. And then water revenues from every station pays for operational expenses, technical and maintenance services, and then capital recovery of all stations. This has been our operation all these years until just 2 years back, we embarked on a special household water connection project. And I must thank the Stone Family Foundation and other partners for making this a reality. Getting water closer to people is our special innovation now. We feel that people now should not go for the water, but we get the water closer to them, especially in this time of COVID, where they get to have water in their homes, not to go and queue at the standby. So last year, COVID came in and Ghana had its fair share of the impact. And as part of the Ghana government's effort to combat the pandemic, a directive was given to all producing entities, both private and public, to provide free water to all, what became popularly known as the free water mandate in Ghana. Safe Water Network, as an organization operating in Ghana, also participated. Interestingly, we had to now shift immediately from paying for water to free delivery. Water Network responded in 3 fronts: production, distribution, as well as consumer engagement. So in production front, we increased water production by 25%. Next slide. Next slide, please. So production, we increased our production of water by 25% to meet growing demand as a result of free water mandate, making sure it continues to meet WHO standard and then Ghana Standard Authority benchmark as well. We increased manpower as well as man hours, working 24/7 to make sure our downtime is reduced to the barest minimum, that is less than 5%. In distribution front, We expanded water distribution, making all our public standpipes, over 530, up and running effectively so that water can get to all these people within our catchment and operation areas. We connected Safe Water to 20 healthcare facilities in Ghana. And I must say that this Safe Water access to healthcare facility project is still ongoing across Ghana, especially where communities that Safe Water Network operates. We further expanded our Safe Water distribution under our new prepaid household water connection project. With its enabled technology, Safe Water Network added over 70 kilometers of water distribution network to over 1,300 homes in the Ashanti region of Ghana. And this project too is still ongoing. In the consumer engagement front, our strong community focus and dynamic local capacity aided Safe Water Network to embark and continue to do same local outreach to educate staff and consumers of safe and hygiene protocols, especially hand washing with soap, wearing of nose masks, social distancing, avoiding touching, etc. Safe Water Network public and safety education geared up as our community liaison team embarked on printing and posting public health information posters at our water stations, schools, and healthcare facilities, especially where we operate. Now, indeed, we were able to do all this, not just that because because the model we had was good. COVID-19 response impacted on Safe Water Network finances and operation, but it also showed our strong resilience, and this is how. Operation-wise, even though it stretched our operational capacity by 25%, we still could deliver safe water continuously throughout the year. Safe Water Network do more training and capacity building for field staff and back-end support. We also improved, next slide please, we also improved our supply chain strategy. In finances, even though free water mandate increased Safe Water Network production and operational expenses by 27%, and then revenue lost by 73% compared to the previous year, our maintenance and capital recovery system could sustain our ability to deliver free water to people for 9 continuous months without any payment from government yet. In our social and economic front, even though it poses high risk to our field staff, it enables us to get closer to our customers as we engage more public health education and COVID-19 protocol demonstrations. We also made sure water was available for all household needs. And our household connection service assisted consumers to observe COVID-19 protocols. In all this, next slide, please. In all this, we learned some, we came across some learnings and then recommendations we wish to share. Next slide, please. Yes, indeed. The SWE's model is tested and it works, as it has been stretched to maximum limit and still capable. So we recommend here that we continue to improve our funding gaps and external resource support. Again, SWEs need to be ready in all aspects at all times to respond to unforeseen public health emergencies, such as the one that happened, and as we are still facing. We also recommend that we build extra capacity that we can fall on in times of emergencies like this. Another critical observation we had was the inadequate updated standardized reporting procedure from government to SWEs to follow during emergencies for sustained operation. And here we recommend that there should be an updated and standardized reporting procedure available for all SWEs for smooth implementation of any emergency call that happens. And obviously, it was evident that our household water connection of safe water to household during COVID-19 crisis, amongst other benefits, made it easy for consumers to reduce people contact because water was getting closer to them via their homes. Now here we recommend that we scale up household water connection services with its enabling technology so we can contribute, or we can continue to contribute efficiently battling of the pandemic and any other health emergency in future that may occur. I will end here with a very big thank you for your time.
Thank you very much, Joseph San. We have one question here. What is major change in customer behavior before and after supply of safe water? And how do you measure the impact?
Good. So before the pandemic, I mean, people were going to the standpipes, for instance, and then also queuing at the standpipes and then making sure they get their water. Now, as we embarked on our special household connection project, water was now getting closer to people in their homes. So this changed this behavior where people now go to crowd for water, but rather get the water. So it assisted people to stay safe, as it were, to have their own water in their homes.
Okay, and as a service provider, have you faced any conflict while distributing? More specifically, how do you enter a community and set up the services while ensuring that there are no conflict of interest?
Okay, like I said in the presentation, we involve government every step of the way. So before we enter into the community, and operation is more community focused, we engage the community leadership, and they in turn form a water board that govern the project. So in all, it is accepted by the community and it is almost run by the same community. So we are always in tune with the community to deliver. There hasn't been any conflict so far.
Okay, thank you, Joseph. One last question from the audience. How do you ensure the transparency and accountability on water supply in terms of people reach and revenue generation?
Okay, so the water stations are managed by people we select from the local and then train them on all the water management skills, and then also how to operate the station well. Now, because we have a water board that oversees the revenue that comes, they are in tune with the revenues and all the expenses that goes with it. So transparency is there. For quality, we have every month check of our quality, water production quality with the standard authorities. So that is also transparent. And then the results are also pasted in the station for all community to see. So they are assured of the quality they are using, the revenue that is coming to their, it is transparent to them and they are all right with that.
Thank you, Joseph. I have a question on my side. So the water was free for 9 months, I think, but now the water people have to pay again. How did the consumer react? Because they were used to have water for free, and now it's back to for them to pay for it. So how did you manage to make this change?
Okay, I mean, it is true. I mean, paying for using water for free and now you have to pay, it's a drastic change. So we needed to do consumer engagement and then community engagement, where now we sensitize the community that we are moving from that phase to a fee paying. So we gradually sensitize them into the phase and they were able to adjust to it smoothly.
And the last question before we close the part of the speaker is, how did you manage to financially, I will say, survive without having any revenues during the period when the water was for free?
Good. So initially, government promised to pay for the water, but the water, they had to submit their invoices. Government became overwhelmed with all these invoices. They needed to audit it before. It's taking a while now. For over 9 months, we've not gotten any substantial pay from government. But financially, we were falling on, like I said in the model, every station was managing its revenue. So the capital reserve that was there was used to make sure the continuous delivery of water for free, because there was some reserve. And then we also fell on our external support for some support when the time was reserved. Because of the model, it was able to put some money there for each station whenever there is crisis like this or any emergency like that. We fall on that to make sure continuity water is continually delivered to our people.
Thanks a lot, Joseph. It's impressive to see, how you have managed to pivot. I can imagine that it must have been very scary that overnight it has been asked to give the water for free, so losing all your revenues. But you successfully went through it. So again, congrats. I think all those speakers show really the importance of agility, flexibility to ensure to go through the crisis. So congrats and thank you to Divya, Joseph, and Julien and the team on the field, because there are lots of people behind you also, for sharing your experiences and the work you are doing every day. You have demonstrated that you have been instrumental, in fact, during this pandemic crisis, not only to give access to safe drinking water, but also to convey government or WHO messages. Next slide. So therefore, I think it's time now for the government, for funders to play their role, because it has been demonstrated that Safe Water Enterprises are a model that can reach vulnerable population to give access to safe drinking water. They have played a key role during the crisis, but now to scale and to be able to reach the 2 billion consumers that lack access to safe drinking water, we need policymakers to integrate the Safe Water Enterprise model in national water strategy. We need to create an environment for scale-up, specific regulations. And for the funders, there is a need for investment on water-related businesses. We need to accelerate blended finance. It's very important. So Safe Water Enterprises have demonstrated their role. They have been very important. So if we want to achieve the SDG and shape a new tomorrow from the global pandemic, we must scale up this sustainable solution to ensure access to drinking water despite crisis. And we need policymakers, we need funders. So let's scale the model to fill the gap and ensure water access to the 2 billion people who have not yet access yet. Thanks a lot. Thank you, Joseph. Thank you, Julien. Thank you, Divya. And thank you to the audience. Don't hesitate to reach out to us if you want to have more information.